So in my last video, I described to you about cancer screening and what is the ideal test for cancer screening and all. So today let's learn about what cancer screening tests are to be done for women. The most common cancer screening tests for women are breast cancer screening and cervical cancer screening. For women who are above the age of 45 years, breast cancer screening is recommended by doing a bilateral mammogram, which is a simple X-ray, and this test is recommended to be done once in every year. And apart from this, if a female is having a family risk or if the breasts are pretty dense on a mammogram, for such females, MRI test is recommended. If at all the woman is having a painful breast or small breast, so in such females, performing a mammogram might be difficult. So in such females, ultrasound examination of both the breasts is recommended. And once in a year, it's also advised for a clinical breast examination by a doctor. So you might be meeting a doctor once in a year for any simple examination or anything. So whenever you meet a doctor every year, ask them to examine your breast. And when do you stop this breast cancer screening? So if the female has attained the age of 70 years, so in such females, maybe you can discontinue doing this breast cancer screening. And coming to cervical cancer screening, this is the second most common cancer among females, and the screening test for cervical cancer as per guidelines start from the age of 21 till the age of 70 years. So what are the tests available? There are two different tests which are available. One is HPV DNA and the other one is Pap test. These tests can be done individually or as a combination. If you're doing just a Pap test, it is advised to do once in 3 years, which is a simple swab which will be taken from your cervical smears by doing scrapings of the cervix. And HPV DNA test also can be done. And if you're doing this test in combination or just HPV DNA, this test is recommended once in 5 years. So if there are any abnormalities detected, then further examination and further biopsies can be considered in such patients. So apart from breast and cervical cancer screening, you also have additional tests. For example, colon cancer screening is also recommended among females who are above the age of 45 years. There are many tests to do colon cancer screening. You can do a stool occult blood test once in 3 years, or you can perform a sigmoidoscopy or a colonoscopy, full-length colonoscopy once in 10 years. And you also have lung cancer screening in females who are smoking. So in such females, low-dose CT scan is recommended to be done once every year. And apart from this, you can also get an ultrasound abdomen to look for ovarian malignancies, and some tumor markers can be done like CEA and CA125, individuals with high risk, to look for liver cancers or ovarian cancers. These are the tests which are recommended for females who would like to undergo cancer screening. Thank you.